Gillian Sutherland, and I'm a community pharmacist, but I work for Northland DHB as the Community Pharmacy Advisor. Pharmacists over the last 2 years are actually going through a huge transition. There's a new contract in New Zealand, and that's actually requiring pharmacists to take a much more patient-centric approach. So that's actually part of the national contract. But in Northland, our Community Pharmacy Services Development Group have worked with the DHB and developed various services for community pharmacy to deliver. And these include things like SSRI counselling, oral anticoagulant counselling, plus counselling for patients who are being discharged from hospital. In particular, those patients, when they're discharged from hospital, that are at high risk of readmission. So a lot of these additional services, in addition to the LTC service in the national contract, really does concentrate on non-adherence, patients who adhere poorly to their medicines. And that, when you actually think about that, medicines are a large part of therapy for a patient, and for patients with long-term conditions, if they don't take their medicines as prescribed, what we actually find is their outcomes are much worse. And there is clear evidence that about 50% of patients with long-term conditions don't take their medicines as prescribed. So there's two types of non-adherence, intentional and unintentional non-adherence. Patients with unintentional non-adherence can often be managed well by the community pharmacy, providing education and support to them by means of compliance aids, etc., to assist them to self-manage. Intentional non-adherence, however, is a little bit more complicated. It's often about beliefs, and that usually requires a more concentrated education effort and trying to understand what the patient's issues are and barriers are to them taking their medicines. Pharmacists can actually help out in both. It's really the energy and effort that's required to change beliefs. That's much more of a cognitive behavioural therapy change that's required. I think in Northland we're quite lucky that the relationships between the healthcare professionals is extremely good, and so I think that helps a lot, and I think pharmacists have actually found it quite easy to become much more of one of the care team members. I think the services, the patient-centred services that pharmacies are trying to focus on now is really actually trying to find out what the patient issues are and actually trying to motivate the patient to understand their condition, to understand why the therapy is important, to understand what the consequences of not taking their therapy are. So it is working much closer with the patient and really trying to get the patient to be part of care and to buy into actually looking after themselves and taking medicine as part of looking after themselves.